New at noon, Virginia students are taking their mental health into their own hands. CBS 6's Brendan King has been following how one youth group addressed members of the General Assembly today to push them to expand funding for youth mental health. Brendan joins us now live with the update.
Good afternoon to you, Cheryl. These young advocates have an excused day off from school today. That's because they're meeting with lawmakers, they're touring the General Assembly and talking about what is important to them. And for this young generation, at the top of their minds right now, it's their mental health.
It's honestly shocking to see how much of the budget goes towards things other than our youth, even though the young people are our future. They face the effects of social media, politics, the effects of the pandemic, and traumas that they have faced in their day-to-day lives. Although there are counselors available within schools, most of them are not properly equipped to deal with the mental health issues that the youth are facing today.
Yeah, this is Virginia's Youth in Action. They're standing alongside a bipartisan group of lawmakers from both the House and Senate this morning, convened by Voices for Virginia's Children. So last month, Governor Glenn Youngkin announced a 3-year plan called Right Help Right Now to transform Virginia's behavioral health system with an initial $230 million investment towards crisis care, service delivery, and workforce support. But listen to this, only 10% of the state's funding to the Department of Behavioral Health and Developmental Services is spent on children. So in addition to seeking funding to increase school counselors and mental health professionals, there's also been legislation introduced to provide flexibility to licensure requirements to employ those positions like counselors and mental health professionals. And to build on this proposal, lawmakers also seeking amendments to the budget that allow school divisions to fund mental health services through Medicaid and improve the children's crisis response services in communities.
Medicaid funding services for young people in schools significantly dropped during the pandemic, as we all know, and a replacement has not yet been implemented.
And lastly, we're going to tighten down the definition of our school counselors. Right now in the code, it requires that 80% of school counselor time is required to counseling. However, because the definition is so open, they often get assigned to recess, to lunch duty. They get assigned to substituting, all within that umbrella definition.
Well, according to the 2023 State of Mental Health in America, Virginia right now ranking 48th in access to youth mental health services. And so no matter if you're a Republican, an independent, or Democrat, there are very few issues that actually bring these parties together, Cheryl. So clearly mental health is top of mind and is so important to so many Virginians right now. At the state capitol, I'm Brendan King, CBS 6 News.
Thank you for the update, Brendan.